Hi, just in case my laptop doesn't work at 5. This is Bipolar Back Room at 2:15. Okay, so I probably am only going to have a chance to explain a few more variables when it comes to bipolar illness. So I just labeled this number 1. It's called unipolar, and it's a rare occurrence of manic patients with no apparent history of depression. And they finally decided to just call it a variant of bipolar illness. Bipolar 1, Roman numeral 1. Full mania lasting 7 days or requiring hospitalization. Manic episodes can include symptoms such as a break from reality. Bipolar 2, hypomania and depressive episodes. A pattern of hypomania episodes which are less severe and shorter form of mania. It does not involve full manic episodes. So we're talking about hypermanic. CYCLOTHYMIC, cyclothymic. That could be close. I'm going to check on how to pronounce that. Is a mild chronic mood swings along with rapid cycling, which we've talked about before. Characterized by chronic, milder mood. Fluctuations include hypomanic and depressive symptoms that last for at least 2 years, 1 year in children and teens. Rapid cycling, which I've spoken about before, experienced a person has 4 or more mood episodes, manic, hypomanic, or depression within a 12-month period. Mixed features, which I spoke about that before, occurs when symptoms of both mania and hypomania and depression happen simultaneously, such as high energy with low mood. And these may be caused by I'm talking about another type that may be caused by certain drugs, alcohol, or medical conditions like multiple sclerosis or a stroke. And this is something that I wasn't always sure about. Bipolar Roman numeral 1 and bipolar Roman numeral 2 are distinct diagnoses. Bipolar 2 is not a milder form of bipolar 1, but rather a different, often more chronic presentation of depression. In other words, when we say chronic, the rest of your life. And between episodes, some people have long periods of emotional stability. This is when people with bipolar illness can get things done. And long periods of emotional stability, you wouldn't notice that they have a mental illness. And a treatment plan for all of these bipolar types is healthcare professionals, possible use of medicines, and talk therapy, also known as psychotherapy. So, I forgot about unipolar. I had studied it before, but I kind of forgot about it. And then I like the fact that bipolar 1 and bipolar 2, bipolar 2 is not milder form of bipolar 1, but rather a different and more chronic presentation of depression. And I was thinking, I haven't finally decided, but I was thinking of taking each of these types of bipolar illness and making an episode around them, like unipolar, bipolar 1, bipolar 2, and that sort of thing. So that might take 5, maybe 6 episodes, depending. So I'm going to drop this in somewhere and you can watch it at 5, but I have to talk to somebody at YouTube, their little AI chat or something, to find out why it's not easy to go on my laptop. So have a good day, and here's hoping that we can be live at 5 Tuesday tomorrow. Take care. Bye-bye.